Health Watch is presented by UMass Memorial Healthcare. Here, caring for you.
So when patients have made a decision based on talking to their primary care physician or maybe to specialty physicians that they see and talking to their family members about it and maybe friends that they have who have thought about weight loss surgery or had weight loss surgery, and they come to making that one decision that it's time to look at that for themselves, really there are two things that they're looking at or should be looking at. One is where to go to find out more about surgery and be evaluated and potentially have their surgery. And then the second question that will come up is what kind of surgery to have. In terms of the decision about where to go, we have a terrific multidisciplinary weight center here at UMass Memorial that offers lifestyle-based programs and bariatric surgery, with the surgery being a major focus of our work here. What we're able to do by integrating registered dietitians, clinical psychologists, our exercise physiologists, all of our support staff, the surgeons and the other physicians who work here, is really help bring a patient through a process of deciding for sure that weight loss surgery is the right thing for them and that now is the right time to be looking at it and doing it. Once that decision is made and we're able to start working with patients and their providers, we guide them through a process really of preparation and education that relates to these surgeries specifically. There are 3 surgeries that are performed here by the surgeons at UMass Memorial Weight Center. One is the gastric bypass, second is the sleeve gastrectomy, and third is the adjustable gastric banding surgery. They're all very good surgeries. We know a huge amount in 2013 about safety, and we know a huge amount about long-term results of these surgeries. And all of that information is good, but it's different between the 3 surgeries that exist. Bypass is sometimes sort of referred to as a gold standard surgery. It's the one that is done most frequently, not just here, but at weight centers and other hospitals across the country and really around the world. We know the most about where patients will be at in terms of weight loss and impact on medical issues a year, 5 years, 10 years down the line, and even further, just because there are so many patients around the world who have been through this process. Bypass is a procedure that patients tend to gravitate to if they have a lot of weight to lose, so our heavier patients, even within our group of people who come here for weight loss surgery. Patients who have type 2 diabetes, especially because the bypass has a direct impact even before people start to lose weight in terms of improving blood sugar control, and that's a big issue for a lot of our patients. Weight loss with bypass tends to be faster compared with the other 2 surgeries. It's a little bit more predictable compared with the other 2 surgeries. And as I made reference to, the impact on the medical issues can actually come even before a lot of the weight loss happens. So there's a lot really going on that is beneficial to patients' health after bypass surgery. With that comes some issues that we really help people understand before they make the choice and make the decision about bypass. It is more of a surgery. People a lot of times say it's a more invasive type surgery because it does involve dividing the stomach into 2 parts and making connections with the small intestine that are done by the surgeon when the surgery is done. But again, having done thousands of these here, through the surgeons here at UMass Memorial Weight Center, we're very comfortable with the safety profile of it, and especially when we're comparing that with some of the really significant medical issues and risks that patients are exposed to because of their weight problems and the associated medical issues they have with it. For patients thinking about bypass, we're going to spend a lot of time with them making sure they understand everything about it before they completely, decide to go that direction. The sleeve gastrectomy, we would sort of say is a little bit newer, although it has been around a long time. We're doing a lot more of it now and in kind of different circumstances relative to how it was looked at even a few years ago. The sleeve gastrectomy previously was looked at as step one of a two-step weight loss surgery procedure. What was discovered as that kind of was happening and being done is that people did pretty well with that first step, the sleeve gastrectomy, without having to go to the second step, which is another surgery that's really not done very frequently anywhere anymore. So the sleeve gastrectomy in and of itself, sometimes also called gastric sleeve, became a very acceptable and now an increasingly popular type of weight loss surgery procedure. It involves really decreasing the size of the stomach, and unlike the bypass where all the stomach and nothing is removed from a patient with bypass, with a sleeve gastrectomy, part of the stomach actually is sectioned off and is removed from the person, leaving a sleeve-shaped stomach. Sometimes we describe it because it's a little bit more descriptive of what it looks like a banana-shaped stomach, which is smaller than what was there before. Interesting thing about the sleeve gastrectomy, we're finding out more and more as time goes by, is that it does seem to have an impact on diabetes and on blood sugar control. It definitely has an impact on appetite and fullness that people feel when they eat. But the results that we're seeing with this, not just here at UMass Memorial, but in other places that are doing more and more of these, because more and more patients are coming asking about it, the results that we're seeing are really good. Again, the work that we can do here with our multidisciplinary team is actually for each person to say what would be a good fit for you, for this person, and really based on the specifics, your age, your weight, your medical profile, to say, well, here's what we'd anticipate for a result going down the bypass direction, going down the sleeve direction, or the banding direction. So in terms of the banding, I would say that overall we're seeing a little bit less demand or less interest on the part of patients in the banding procedure. But I would say that we're doing more of it on people that we feel more confident they're going to do well with it based on their specific kind of characteristics. I know there was a big story in the news yesterday about Governor Christie and choosing to have an adjustable gastric band. And so a person who came to us interested in a gastric band, we would do, and I'm sure was done for him, a really pretty extensive, not just medical evaluation, but also sort of a psychological, behavioral evaluation in terms of the types of vulnerabilities that people have relative to their eating and the kinds of things that sort of conspired to get them into the situation where they're struggling with a real significant weight problem. Patients who do well with bands, typically they don't have huge amounts of weight to lose. So I'd say patients kind of about 100 pounds over over a lean body weight, as opposed to people that we might see who maybe are 200 or 300 pounds over a lean body weight, who definitely those people gravitate more in the bypass and sleeve direction. Again, getting back to the sleeve, people who do well, people who are ready to commit to a real physical activity program. The common denominator in people who do well long-term after bands are pretty much daily exercisers or people who really are connected to a really a good solid exercise routine. Also, people who come into it with pretty good dieting skills. So I always tell patients, really with any kind of weight loss surgery, but especially with the band, that if you can do pretty well with dieting and exercising, even if the result is modest and kind of temporary, weight loss surgery is something that can turn kind of average, maybe temporary results with dieting and exercise changes to really great and much more permanent results. Same kind of changes, but the surgery really helps keep people on track with changes for a long enough period of time that those become permanent changes and hopefully permanent weight loss. And we do a lot of work here, again, with our multidisciplinary team to support people afterward. Having weight loss surgery is not an ending, we always tell people, because a lot of patients very naturally look at it kind of, that's the finish line, but it's really not the finish line. I tell people it's like, you know, coming around again, and it's a start in a lot of ways. And the multidisciplinary team here, again, our psychologists, our dietitian, our exercise specialist, all the clinicians here who support you and get you ready, that's the same group that will support you and keep you going after surgery in terms of getting that great long-term result that everybody wants to get. This is not a quick thing in terms of getting ready, and it's something that we want to make sure that everything we're doing beforehand and right around the surgery and as the months and years go by is going to maximize the chances that people are going to get great long-term results with weight loss and the impact on their chronic medical issues.